I'm Ricardo Gonzalez, and this is my final exam on colonoscopy. First, analysis of colonoscopy. It's used to detect early signs of colorectal cancer, polyps, and other abnormalities in the colon and rectum, which is why it is so important to get this procedure done. It is able to detect early signs of cancer or conditions like inflammatory bowel disease and diverticulosis, and what those are exactly is on the images on the right. Colonoscopy is both diagnostic and preventative. It allows for immediate actions such as the removal of polyps to prevent cancer, and it can also be used to diagnose symptoms such as unexplained abdominal pain or blood in stool. Without a colonoscopy, conditions like cancer may go undetected and untreated, which could lead to progression, severe health complications, and potential death. Early detection can improve treatment outcomes and survival rates for colorectal cancer. Typically, the recommended age for a colonoscopy is around 45 to 50 years old, but some children may need to get this procedure done sooner for earlier screening because if they have conditions like familial adenoptosis, polyposis, then that is needed to get it as soon as possible. Now, the description of colonoscopy. This procedure is usually performed in a hospital, outpatient surgical center, or specialized doctor's office. This procedure is performed by a gastroenterologist who is a doctor who specializes in the digestive system. The tools used in this procedure is a colonoscope, which is a long flexible tube with a camera and light at the end to visualize the colon, suction tools to remove fluids or tissues, biopsy tools to take tissue samples if needed, sedation equipment for patient comfort during the procedure. Prior to the procedure, the patient must undergo bowel preparation to clean out the colon. The patient may need to stop taking certain medications to prepare or prior to the procedure. The risk of the procedures include bleeding, perforation of the colon, infection, and adverse reactions to sedation. Especially if polyps are removed, that will cause more bleeding. Outcomes. This procedure is generally safe and most patients recover quickly with minimal discomfort, so it's not too dangerous of a procedure to be done. Prognosis. If cancer or precancerous polyps are found, timely treatment can significantly increase survival rates, which is how this procedure is very preventive of cancer. It's not personal accounts. I don't have any, but I'll be using a case study. So how does it feel to get this done? The 72-year-old elderly woman experienced discomfort during the preparation phase. Before the actual procedure is done, laxative use and fasting is needed. The pain is typically uncommon, but some patients may experience cramping or bloating. This procedure may feel embarrassing to some, but healthcare providers are trained to ensure a comfortable and respectful environment which can reduce the anxiety you may be feeling. A way that this procedure can be easier on a person was because the woman was sedated during the colonoscopy, which made it more pain-free and more tolerable. The emotional issues are caused from this, so support from family members would help or did help the woman for her emotional comfort. So it is very important to have a strong base behind you if you are in need of some help. Colonoscopy is a life-saving procedure. And yes, I would encourage this procedure because it is so important to have such a preventative thing done in order to not have the result of cancer. It is such a crucial part of preventative medicine. I would convince my mom, dad, or sibling to get this procedure by highlighting the importance of early detection, by reassuring them the procedure is safe and there's not many negatives to it. Then I would encourage them to prioritize health because the benefits outweigh the negatives. I believe some of my strengths are I felt this information on the slideshow is very informative. I felt like I did a good job at describing the information that was on the text and outside of it. I felt like the slides were a pretty good length. Some weaknesses I do believe I had wrong. I could have chosen better images. The images were pretty bad. Then I felt I could have done better. I think my flow is off when explaining. I need to sound more confident when I'm talking.